Hello, my name is Peter Lawrence and I'm pleased to introduce the October issue of the Journal of Vascular Surgery and to highlight 3 outstanding papers that are freely available for the next 2 months. The CME article and editor's choice for this issue, which is seen in this visual abstract, is entitled Retrograde Open Mesenteric Stenting Should Be Considered as the Initial Approach to Acute Mesenteric Ischemia by Androska and co-authors. They compared open mesenteric stenting as an alternative to traditional bypass in patients who present with acute mesenteric ischemia. All patients at the University of Pittsburgh who presented with acute mesenteric ischemia from 2008 to 2019 were included. 34 patients either underwent mesenteric bypass or retrograde stenting in approximately equal numbers. The procedural time in the OR was significantly longer with a bypass, and at 1 year, only 1 stent thrombosed, requiring a later mesenteric bypass. However, 1 initial bypass also thrombosed, resulting in a perioperative death, and 1 bypass anastomosis stenosed, requiring angioplasty. The complication, reintervention, and mortality rates were otherwise similar between the 2 groups. So the authors concluded that retrograde stenting should be the first option in patients with acute mesenteric ischemia. The next article by Scher and co-authors, entitled Safety and Feasibility of Transradial Infrainguinal Peripheral Arterial Disease Interventions, analyzes the use of newer length wires and catheters that originate from the radial artery and are used to treat infrainguinal peripheral arterial disease. 32 patients with PAD who had a left radial artery of greater than 2 millimeters underwent peripheral intervention. The treated vessels included the common femoral artery rarely, but more commonly the superficial femoral, the popliteal, and even the deep femoral artery. In addition, the tibial-perineal trunk, tibial, and plantar arteries were occasionally treated. Interventions included angioplasty, atherectomy, and stenting. The authors reported a procedural success of 100%, with a later failure rate of approximately 11%, and the clinical success based on measurement of AVI and improvement in perfusion was 89%. At a median follow-up of 286 days, adverse events included a single radial artery pseudoaneurysm, several access site hematomas or bleeding, 1 radial artery occlusion, several groin hematomas, 1 popliteal artery dissection, and 1 localized SFA perforation that was treated easily. No patients had a cerebrovascular event or distal embolization. The authors concluded that transradial interventions are a useful option for treating patients with PAD. The final article in this series, and highlighted this month, is arterial reconstruction with human bioengineered acellular blood vessels in patients with peripheral artery disease by Gutowski and colleagues from Duke. They've developed a tissue-engineered human acellular vessel, or what they call HAV, H-A-V, that can be manufactured, stored on site at hospitals, and be immediately available for arterial vascular reconstruction. HAVs were manufactured using human vascular smooth muscle cells grown on a biodegradable scaffold. Following adequate cell growth and extracellular matrix deposition, the vessels were then decellularized to remove human cellular antigens. The manufactured vessels were implanted in 20 patients with peripheral artery disease as above-knee femoral to popliteal artery bypass conduits. All HAVs had no structural failure or rejection by the recipient. One vessel developed a pseudoaneurysm during balloon thrombectomy. No amputations occurred in this group of patients over a 2-year period. The early clinical experience with these vessels in the arterial position suggested that they're safe, have acceptable patency, a low incidence of infection, and, most importantly, do not require the harvest of autologous vein. And histologic examination of these biopsies revealed that there was vascular remodeling and repopulation of the interstices by the host cells. Thank you for watching and hearing about these 3 important papers. For more information, please follow us on social media, and remember that to like, comment, and share. We hope you enjoy each of these highlighted papers and the other excellent papers in this month's Journal of Vascular Surgery. Remember that these articles are free to read until the end of October. And thank you for your attention.